Hello, I'm Ursula Marinelli, the Executive Director of the Pacific Communities Health District Foundation. Welcome to Part 2 of the Samaritan Pacific Communities Hospital virtual tour. The new hospital was funded through the Pacific Communities Health District bond measure that was passed in May of 2015 by the voters. If it were not for the pandemic, we would all be getting together and having an open house to celebrate the completion of the new hospital project. And you'd have a chance to see this facility for yourself. In lieu of that experience, Jane Russell, our Chief Operating Officer, and Dr. Leslie Ogden, our Chief Executive Officer, are taking you on a virtual tour. In this video, they will guide you through the two-story building of the hospital, which was finished in March of 2020. This is part of the existing structure that was originally built in 1988, but renovated as part of the new hospital project. During the renovation, the building was seismically upgraded to withstand a magnitude 9.0 earthquake, which of course is essential here on the coast. In addition, John Connor, our Director of Plant Services, will take you on a behind-the-scenes glimpse of the central utility plant, which is really the heart and brain of the building. Thank you for joining us and enjoy your tour.
One of the unique things you'll find in our Galleria as you enter the hospital are a number of significant architectural types of things you should notice. The very first thing we see are the choices of colors. And so you'll notice some beautiful blues and some browns that are representative of our coastal surroundings. If you look at the edges of things, such as this railing, you'll notice that it has a nice curve to it. That and other things that you see that are curved are significant for waves in the ocean. And then one of the neatest things is up above us, there are concentric rings that form the centerpiece to the skylight almost in the ceiling. And that represents a drop of water on the surface forming those concentric rings. So everything around us reminds us of the unique coastal environment that we live.
Welcome to our lab. In this lab, we take care of our outpatients as well as our patients that are hospitalized. We do 22,000 lab tests per year out of this space. In addition, we have increased our lab testing capacity since COVID, and we do perform COVID tests with our equipment here in the hospital.
We're now in the cafeteria area of the hospital, and this is unique in that we went from a very small cafeteria to a really large, inviting area. Not only do our employees enjoy this, but in non-COVID times, we've had lots of members of the public come in as well and enjoy the food that is created here. This whole area is keyed into food and the healthy food that we can provide, and we have everything from a pizza oven to a coffee bar, all really geared to make sure that we're providing the healthiest food for our employees and our patients throughout the hospital.
Welcome to our new infusion space. I'm currently standing in one of 12 bays where we provide care to about 60 patients per day in the infusion clinic. Interesting fact is that over half of our infusions are actually non-chemotherapy. So not only do we provide cancer treatment for patients here, but we also provide IV fluids and blood. Our infusion center is very busy, and if we weren't here in the dark, you would see a beautiful garden right outside the window. We're currently standing in our wound care department. We have 8 bays where we provide different types of wound care for patients. This is a great dedicated space for our patients with those needs, and the expansion in this new hospital has allowed us to have our family medicine, podiatrists, and general surgeons come to this area to work collaboratively with our nurses to provide care for our patients.
We're now currently in the sleep lab area where patients can come to be evaluated for their sleep-related disorders. Things like sleep apnea, for example, can be evaluated with the patient spending a night in a private sleep room where they are monitored by a technician for that time. In addition, other things that are done here include neurologic evaluations like encephalograms that can be done on your brain. We're now in the cardiac and pulmonary rehabilitation area where patients come in and they are worked with by therapists and other specialists to identify both the exercise and the regimen that is best for their particular disease process. You can see we have Jane working out on a bicycle, and we have a myriad of other types of equipment that can be used specific to patient needs. So this space is basically a safe space for them to come and work out under the auspices of specialists and therapists who can make sure that they have the safest, most productive way to get back on track.
So we'll talk a little bit about the differences between the old facility versus the new facility. First off, with the heating system, in the old building we ran a 7-pound steam system, which was really very inefficient. It was installed, I believe, in the late 1970s. So on a good day we were probably running 73, 75 around there % efficiency. We switched to hot water condensing boilers, so right now we run about 97% efficiency for our combustion rates. For our cooling system, the coastal environment, as everybody knows, is very caustic on equipment that's outside. And so we switched from air-cooled equipment, which essentially uses the outside air blowing over equipment to cool it, to water-cooled, where we send water outside, we run it over some fins, air blows over that water, brings it in cooler, and we cool the equipment that way. Because we have so much equipment damage when it's exposed to the elements. So we switched to a water-cooled system, which has really been very efficient. And we have a building automation system as well now, so whether I'm here in the office or whether I'm off-site at a different facility in a meeting, or if I'm even at home, I can call up our building plant and see exactly what each piece of equipment is doing. So for our operating rooms, I can tell you return air humidities, what supply air temperatures are, air movement, anything like that we would need to see.
I hope you enjoyed part 2 of your virtual tour. Many of you helped to equip this new facility through the foundation, and for that I am forever grateful. Through this new hospital project, we are truly building healthier communities together for generations to come.